Hello and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and the owner of Ascend Health Center. And I'm here with Dr. K from One Ripple Effect. How are you doing, Doctor?
I'm doing excellent. How are you, Nick?
I'm great. So this is technically our second show together since the first one was canceled due to COVID. And that's when I was in my $680 a month apartment in Fairlawn, waking up and trying to talk to you about rumination and probiotics.
That's okay. We had fun doing it, right?
Yeah, it was a great show. You should go back into, when was it, 2021? And see everything that we did. Yeah, well, it's changed your life. So today we're not going to talk about probiotics, since again we've already done that, and I think this is my 54th show. So I'm going to try to talk as little as possible, because anything that I think I'm going to say that's wise or insightful, I probably said it sometime in the last 53 shows. So I'm out of interesting things to say.
Oh no.
But hopefully you've got some. So tell me a little bit more about One Ripple Effect, your latest project.
My latest project. So I'm podiatrist by training, but I realized people needed so much more. So I started integrative health management, which was a functional medicine-based practice, helping people get better, getting to the root causes. But then what I notice is people have a lot of stress. They have a lot of problems. And if we don't fix those problems that are fueling all the health conditions, guess what? People don't get better. Right. So I always joke and I say, I can give you a zillion supplements, but if you hate your mother-in-law and you're living with her, you're just not gonna get better, because there's too much stress and frustration and those sorts of things. So I created One Ripple Effect to change those couple of things in life that will change everything for you. So I search, and I'm really good at that. Like, I call it intuitive introspection, where I find that thing that needs to change so that everything in your life changes, health included.
Okay, so almost from a medical standpoint, it's almost like a differential diagnosis, where you're telling me this is my problem. And a lot of times we see this at Ascend, where a patient will be like, wait, that's not what I came in for. And we're like, yes, we know. But part of the way that medicine works is that we have to look at a couple other options that you may not have considered, or that Google didn't bring up on that first page of potential results. And maybe that's what the real issue is.
Correct. I always say, it's not my mnemonic, but I heard it from somebody else. When you're in the bottle, you can't see the label, right? So we often really don't see what we need to change.
So you're the one that comes by and says, oh, actually, here's the root cause, or here's what we really need to focus on, or here's the first step.
Yes.
Yeah. So it's almost like a train where, it has so much force, but then you stop it and you just put a little wedge in front of the wheel, and then that train isn't going to go anywhere. So your job is to pull the wedge out. Correct. Okay, nice. So a lot of what you do is, in seeing your videos, is you deal a lot with men and their mental health and their problems. And just to warn our viewers, at some point in this show, you'll probably be offended by something I say. It's community television. We can say what we want. I gave you the example of our buddy Hank, how we had a show where I was like, well, you're a shaman and I'm a preacher's son. Let's talk about Jesus and energy medicine. Let's make sure to hit all the bases and offend everybody. So this might be a little bit like that. So what I'm going to say is, I used to say men really should express their feelings. And then once I heard men expressing their feelings, I was like, oh, wow, this is... we sound really whiny when we express our feelings. I do in particular, and I feel other men often do as well. So how is men's mental health important, and how can we find that line? Because I didn't think there was one. I thought, like I said, we should just express ourselves all the time, and then I slowly realized, no, it's not always good for society to hear every complaint that a man has just spewing out of their mouth in real time.
Well, complaints we shall talk about. But if you look at the history of men and the paradigm that's been running, you think about it, men in war millions of years ago, if you cried, if you whined, you got shot, you died, right?
Yeah, that's true.
So as time has gone on, it has not been a forefront for men to really express their feelings, and men don't enjoy to hear that word. Let's talk about feelings, right? Because we have a paradigm you have a paradigm that you have to maintain a certain integrity as a male. But I say, physiologically, men and women are different. Maybe we process information a little bit differently and emotions a little bit differently, but at the end of the day, we are still human beings.
Right.
And we still have the same soul level. So I do think things are changing. It's just that we're reaching this paradigm where what was the structure millions of years ago is not fitting the structure that we have now, but it's kind of embedded in your DNA. So we kind of got to switch that, because it's not good for men to keep repressing things. It affects health tremendously. Right. So it's so important.
Yeah, I was at work yesterday, and Mark Garrettson, our nurse practitioner, who was thinking of coming today. In fact, we had another show earlier, and we had a seat for him. And I was like, we might have a special guest. And the only thing people could probably think during that show is, where's the special guest? Who is he? But he told me something yesterday, which was, Nick, I don't think you have a sympathetic nervous system because things don't rattle me. And that has plenty of advantages. I mean, you know, I'm a nurse anesthetist, paralyzing people for surgery, all that sort of thing. But sometimes it could mean that maybe I'm repressing a little bit more than I need to.
That's happening a lot. But that's just what men, I think, are accustomed to in today's day and age.
Right.
And I'm not saying you got to go spew things out like us women do sometimes, but no offense to anybody. But I think really reaching a more balanced equality of, you know, better communication and better alignment is the goal, and that's not happening. Well, it's starting to happen, but I'm there to help that happen.
Right.
Because there's a need for it.
Okay. Yeah. And then how does that work for, and this is going to be a complicated question I just thought of. So I feel our society is really into a gig economy because we don't have those connections anymore. So instead of spending the night at your cousin's house, you have Airbnb. Instead of convincing your buddy to give you a ride to the airport, you have Uber. Instead of sharing somebody your feelings, you have a therapist that you pay so you can like vomit all your issues and they can be understanding. So how do we grapple with the fact that that's how reality is? You got to pay for this stuff, but also make it not seem so transactional. It's kind of a weird question.
That's a loaded question with a lot of angles. How do we grapple with it? Well, therapy in itself, if you think of therapy, it feels very heavy, right? I have to see a therapist. There is something wrong with me.
I have the problem. And honestly, that's partly the insurance system, that if someone comes to Ascend and they see a therapist, like unless we think of something that's wrong with them, the insurance company's not going to pay because they're just going to say, there's nothing wrong with this person. We're not going to pay you money to talk to them. So it pathologizes everything.
Correct. So it puts a stamp on you. So a lot of men, I think, avoid going to that. But you even step into that energy of, oh God, well, I got to see a therapist. Something's wrong with me. So, okay, something's wrong with me. And now there's a diagnosis and there's a slap of a stamp that there's a problem.
Right.
When that's not the sense. We have minds that need processing and just, you know, becoming our whole self, and self-mastery is what I call it. So there's nothing wrong with that. So whoever you go, wherever you go, however you achieve that, I don't think it matters.
Okay.
If that answers your question.
It does, because you're basically
way.
saying, like, look, maybe you, as a man, maybe you spend money at the gym, or maybe you work out, or maybe you biohack with all these supplements, because, you know, both of us being a bit into that alternative medicine, natural medicine, we see a lot of that. So it's a little bit similar, where well, you've worked on your body so much, it's time to work on your mind and bring those two into congruence.
You have to have those two in congruence. You have to be in alignment with both, because if the mind's out of whack, I'm telling you, the body's going to be out of whack. Yeah. And we're going to talk a little esoteric, but spiritualism is really important. Not forgetting that you're a soul inside a body. It's not just your body. Where do you think you came from? Where do you think you'll go after?
Absolutely.
We're not just going to go in the grave and then that's it. We're done.
Right.
There's way more to it. Energy has always been and will always be, and that is part of the mind and the subconscious mind.
Yeah.
So.
And I used to see that a lot. So I have an extensive history working in the ICU before I was a nurse anesthetist. And I'd see families with vague spiritual ideas who would not let their loved one go. Like, we would say, no, they are here in the ICU, like there's nothing going on, there's no hope. And they'd be like, well, wait, let's set this alarm, and then that'll wake them up. They just have all these superstitious ideas because they hadn't grappled with what they actually thought about the afterlife. Or sometimes it was like, well, I wasn't connected to my father, and so I need to do all that now. It's like, no, the chance has passed, and you need to let them pass. But that gets into obviously very difficult ethical and spiritual issues.
It does. There's a lot of highways, a lot of roads to travel, a lot of angles.
And I think what you're saying too is that you do have to get to the root of it. That with your work, it's not like, well, let's just work on you doing some self-affirmations. It's more like we need to get to the root of what the issues are.
Correct. And I think I forgot to mention, I also have a degree in psychology, so I'm bringing all these angles together. So working on the body and the mind are connected. So if the mind's not doing well, and the ego will essentially can make you sick. And we talk about the ego, I'm not talking about something big.
Right.
It's the subconscious mind, the programs that we have that run, that literally can make the body sick if we're not handling it properly.
Sure.
Or in the best way that we can, and creating that alignment.
No, that makes sense, because in that same conversation where I was told I lack a sympathetic nervous system, we were talking about the early days of Ascend Health Center, where we worked even more on pain management using ketamine infusions, and some of the patients couldn't tolerate it. We would try to prepare them. They'd say, no, I don't have any mental health issues. This is all strictly pain. And then they take a substance like ketamine, which works as a mirror, showing you what you are, and everything that's been repressed comes out. And they wouldn't be able to tolerate it. They would be like, no, I'll just keep the pain. Thanks, I don't want this treatment anymore. I mean, since then we've done a lot of work where we'll do small injections and kind of ease them into the process. But at the time I was like, I don't understand it. They said they had no mental health problems. Then I slowly realized, well, at least someone who knows that they've had issues, they've been exercising their mind, again with that gym analogy. So they can take this altered state of being, this altered state of consciousness, and work with it. But if you spend all your life saying, nope, this is just a physical problem, there's nothing wrong with my brain, and just shutting down that ability to really self-actualize, to really see yourself as you are, it's very traumatizing to suddenly come face to face with reality.
Yeah, two interesting points that you bring up. Let's face it, we've all had little T's and big T's. We've all had the little traumas of being left at the grocery store for 15 minutes and our parents are gone. Some of us have had bigger traumas that are very deeply repressed.
Right.
And so it's interesting, I come across this a lot, and people say they want to get help. They come to your door, right? Get rid of the pain. But when you start telling them, well, this is kind of the source of your pain, it's like, no, I'll keep my pain. Because if you get rid of the pain, then what? You really have to look at the deep stuff that some people are just not yet ready to look at, and that's okay.
Right.
When they're ready, they're ready.
But a lot of times it's cheaper for patients if they're willing to, at one time, just get rid of, even if it's forged a little bit to your identity, if we get to the root cause of your problem, even if it causes some pain and discomfort, unfortunately there really aren't any painless ways to get better once you get to a certain point, and that's just the reality of it. So, but I did want to ask specifically, and maybe we'll even talk about my own story. I doubt it, because again, the whole no sympathetic nervous system, I don't always get into it. But you specialize, especially right now, I want to see how many times I can use the word special in a special sentence, but in divorce for men. So how did that come about, and why has that been something that One Ripple Effect's really working on?
Yeah, so I want to clarify, I'm not excluding anybody. It's just
like, I have a happy marriage, she's not going to see me for nothing.
I'm not excluding men or women. I help everybody, so I want to clarify that. But it's a need that I saw. I had a lot of friends that are going through divorces, and they seem to just come to me with, oh my gosh, this is going on, how do I fix it?
Right.
So again, as I traveled through my journey and I did integrative medicine, there was people would just start talking about, I'm having a problem with my marriage or my job or the relationship with my boss or with my family. So it's divorce and relationships, because those are such challenging problems for people and they cause so much stress.
Right.
So typically I have to start working on dealing with some of that, and I have very specific techniques to do that, healing techniques that I really extract issues and things and clear that up so that they feel lighter and brighter. But I noticed divorce was just such an issue, so I'm kind of just helping that area in the moment. Okay. And seeing if we can shift that a little bit, because the divorce rate is, last I looked statistically, was like 61% or 67%, which is really high. So I think the paradigm of marriage the way it used to be is not working so well in today's society. Not for everybody. I'm not excluding everybody here. So we're not offending anybody.
We're just talking
We're
facts.
just talking. But
and besides, I already told everyone that we're going to offend them, so it's fine.
If we're offending you, I'm not saying don't get married. I'm saying there's so many different things going on that what marriage used to be 8 million years ago when we were evolving, the men were out shooting animals and the women were having children. Well, today's paradigm isn't like that anymore. It is.
I mean, somebody has to make a hide out of this mammoth I just speared. It ain't gonna be me. Right? Sorry, continue.
Yeah, but things have just shifted. Women are now doing a lot of that. Women are the head of the household. Men are in the kitchen cooking. So I think things have shifted, and I think the stressors of life, marriage is interesting that it's creating, the divorce rate is so high that it's like people will go in and get married yet again when they've already gotten divorced 3 times. So I have to ask, what is going on that needs shifting? And so that's why I'm like, okay, let's work on this area a little bit. Let's help men a little bit because there's something going on here.
Right. And sometimes it's a visible sign of the breakdown of society. Like there's a lot of things that we can hide, and it's not really a topic that people talk about often. Like if you look at a lot of societal ills, even mental illness, poverty, a lot of it's related to relationships just not working out, and you end up with broken families and generations of this cycle that continues. So you're basically saying that in each case you can find the root cause of like what happened to your relationship, and probably in some cases it's let's work on reconciliation, and in others it's like, well, let's learn as much as we can through this pain.
Correct. I joke though, but if we get rid of marriage, you get rid of divorce, don't we? I really, you know, and I'm not saying, again, I'm not saying not get married. If that's your thing and you love it, do it. But it's just weird what's going on right now in that way. But divorce is such a box. Marriage is also a box. So if we can create some freedom around that, maybe create better relationships, then a lot of that will start to subside. So I thought, give it a chance and help people out that are stuck in those areas because it's so heavy.
Well, I think too, sometimes it's a big T that people think is a small t, to use your trauma example, meaning that because of the fear of divorce, there are a lot more relationships that may last 3, 4, 5 years, and then there's a breakup, and there's not quite the support of like, oh, they're like, what, it was just your boyfriend, like what's the big deal? But that is a huge trauma because that is equivalent to what would have been, you know, a marriage 40 years ago, because you're living with this person, you're with them for 4 years. So, and especially when there's differing ideas of spirituality, it's hard for people to really even comprehend, like, what did this mean? What can I take from this? Other than like some pithy saying about, you know, if you can't handle me at my worst, you don't get me at my best, or, you know, just, because there are jokes about that, memes of like, oh, well, this person's putting all these, like now they only have their middle name on Facebook, and now they're saying all these inspirational quotes. What's going on with their relationship? So it's almost like we've been sucked into like, this is how you react once this happens.
Yeah, it's relationship with self too. I think that's what we ignore a lot of times. We have all these little T's, big T's that start to happen that we didn't really clean up, and now we're dragging them into the future and trying to resolve them within all of our relationships. So that's the key thing. It's not just marriage, it's your family, your boss, your siblings, your friends. It's relationships in general.
Right. Yeah, because it's a unique time too when a family fractures, that it's almost like everyone opens up, that you have this moment of time where people are more willing to see themselves, because, you know, we use the term that you're heartbroken, like you're literally, well, not literally, because your aorta is fine and your inferior vena cava is still doing what it needs to do.
Well, we don't know that. We don't really know that.
Well, you are right though, because there's proven facts that there's significant cell damage from what we consider like, oh, this is just a traumatic experience for your brain. No, your entire physiology reflects what happened to you.
Absolutely.
It's almost like a timestamp on your body that your individual cells are no longer working because this sad thing happened. So I guess in some cases, literally, like when we say heartbreak, it means that, well, now there's a fissure there, there's a crack, and there is a chance to actually meet your inner self, the one that you've been trying to hide or the one that you've shielded for all these years. And so that's the important thing, is that during this traumatic experience, can you, through this pain, actually form a better self?
Correct. So there's often, when you talk about fissures, there's a fissure, a little esoteric there for all of you, but there's a fissure in your aura, and so in your energetic field, and there's also a fissure in your physical field. So often people get sick. Broken heart syndrome is a scientific, you know, event now. When one spouse dies, you often see, you know, the other one goes in late age. So it creates a physical manifestation as well as an energetic manifestation. So this is a pure example of how both work together. So we kind of got to clean both up.
Right.
So, yeah.
So do you find men saying like, well, I wish I had been able to tell my ex-wife this, or almost trying to clean up after the fact? Like, how do you?
I think they want to clean up after the fact. I think the key point here is things start to spiral down, or they were already there. However, when intelligence is high, or I'm sorry, when emotions are high, intelligence is low. So when we're really angry, we say wrong things. When we're in love, we kind of say wrong things as well. We're just, we're out there, we're not thinking straight. So there's often signs things are spiraling downwards. We sweep it under the carpet, we deal with it, and before you know it, like the day comes, here's your divorce papers, and it's like, where did this come from?
Right.
So that's often what I'm hearing. It's either blindsided, comes out of blindsight, out of nowhere, or things have been wrong for a while, but we haven't dealt with it effectively because we just didn't. When it could have been saved and it could have been remedied, but it wasn't. So probably those are the two scenarios that come along.
Well, that makes sense because we see that with physical health. Like, well, I'm taking this pill because the rheumatologist told me to, and this pill because the cardiologist told me to, and this inhaler because the pulmonary specialist told me to. But then after a while, it's like, well, wait, we never addressed whatever the actual issue was, and you can sometimes see that collapse where they end up in the hospital and have to restart everything. So.
Where did it start? Because it starts somewhere. It just doesn't come out. There's always something creeping underneath that we are not looking at, not dealing with. It's fine. And then before you know it, it's exploded into something different.
Right. So then do you have any practical tips? Or because the worry is that, and you already alluded to this earlier, sometimes we'll be like, well, quick, fix me up so I can go get another relationship and keep going. And again, we're not addressing the root causes. So how can we make sure to like pause long enough to actually get the healing we need to find our own, our own fault in either relationship or what led to this so it doesn't happen again?
Well, we often blame. So we don't want to look at where our contribution to this was. And there's always our contribution. So I think the biggest thing is to start pausing and taking some time out for yourself first. Often people start to get into another relationship immediately, or they start seeking their friends, or, divorced men, it's also an arena of who do you talk to? Because your buddies are all angry. They've gotten divorced. Some of them, maybe not all of them. The ones that are married maybe don't want to hang out with you, don't want to have time to hang out with you.
Right, like, is it catching? I don't know if I should hang out with you.
Right?
Am I going to get it? Use some hand sanitizer.
The others, but who do you talk to? Your family is probably giving you an opinion. Your friends are giving you an opinion. But there's who do you talk to that's neutral, that's non-judgmental, that's actually going to help you work through things.
Sure.
And some people don't want to go to therapists. Therapists are there to listen. I listen and clean things up. Like I literally have ways, and we don't have time to get into that today, but I have ways of just cleaning things up for people, physically, mentally, emotionally, and health-wise as well, if it's affected your health. So it's really important to look at all those aspects.
Absolutely.
But yeah, finding the bless in the mess, as Hank says too. There's always something good. Whether you have great children that came out of this whole thing, maybe your children are really good. Maybe you at least have parents that are really good, parents-in-law that are really good. There's always something. Find that one thing and avoid focusing on bitterness, because we have an addiction to focusing on our problems, talking about our problems, complaining. Talk more about your joys, and life will change. Try it for 30 days. Try talking about your joys for 30 days. Start finding them, and your life will change. Guarantee it. Things will change.
No, and some of that is our culture, because I've traveled overseas a lot, and like when I'm in Greece, what do men my age talk about? We talk about a good slice of bread we had. We talk about what our favorite feta cheese is. Like it's not about our prestige, what we're working on, complaining about the kids or the wife or this thing. So sometimes it is just a mindset of like, okay, I know that my mind automatically wants to go to this problem that I have, but I don't have to do that. Again, we're not ignoring our problems, but it's just that, going back to my original point, that sometimes as men, if we do get into that need to express my feelings, it's pretty intolerable for everyone around us. So it's having wisdom in when is it time to share, and when
maybe because you've repressed them for too long.
Yeah, there could be a lot. There could be a lot there.
It does. It happens. It goes sideways when you don't manage the energy that's going on inside. It will come out sideways in the wrong ways, and then everybody around gets offended, and that goes on for too long, and then things happen.
So that's usually what I tell patients at Ascend, because we'll do ketamine infusions. Sometimes it can bring up repressed memories. Sometimes it can, which I'm really making these sound terrible, but they're really not, I promise.
They're not.
But a lot of times they'll have someone like revisit some griefs they hadn't completed, and I'm like, no, you have to go through these, and it has to be through your own power, because if you don't, you'll still go through it, but not at the time and place of your choosing. So I was like, well, just like several times a day, all of us choose when to go to the bathroom, and it works out great. If you don't choose when to deal with your grief, your depression, your anxiety, it's going to be a big embarrassing mess for everybody involved.
Absolutely,
So,
absolutely. And I have to tell people what's on the other side of walking through that door is amazing. I mean, it is freedom. You can heal in an instant. It's where do you want to be?
right. And for my own personal self, I had the opposite problem. I'm like, well, let me sit in this pain as long as possible to get everything possible from it. So again, this is a rare case because I'm a strange person, but there is also the problem of like, look, you wallowed in this and try to get everything you could. It is time to move on and allow yourself to enjoy life and allow yourself to heal, rather than look, wait, maybe there's some more wisdom I can get from this terrible experience.
Absolutely. But if there's a miracle on the other side, do you want to feel good or do you want to stay and wallow in the pain? It's a choice.
So have you ever, told a client of yours, like, actually, you're good now. We don't have to meet this often. Like, you're better. Because
Absolutely.
Okay.
Absolutely. People are like, oh my God, I have so much more energy now. I can think clearer now. Yeah, you've been sitting in this space for so long that you can't see straight, you can't think straight. Now it's affecting your health.
Sure.
You're brain fog, you can't function at work, nothing's going right. So clear it, move on. Why stay in that space? Of course you could choose to stay in that space, but why?
Right. So before we finish, because we have about a minute left, do you have any, like, one practical tip that someone can do in these situations, or anything you can leave us with?
I have two.
Okay.
Number one, start practicing gratitude. So finding that teeny weeny little thing, there is something, find it. Find the needle in the haystack of what you're grateful for. Whether that's a cup of coffee, whether it's you have a house, whether it's you still have your business, whether it's you're maintaining your sanity somehow. Number one, write that down every single day for 30 days. Just three things for 30 days.
Sure.
Number two, focus more on joys rather than having this addiction. Break the pattern of complaints, bitterness, spewing stuff out, and just start talking about your joys for 30 days.
Yeah. Joy and gratitude are very powerful. And because I was originally going to ask you about how do we keep this from just being some positive saying, but I think that's the answer, is through joy and gratitude, because those aren't superficial emotions. Those are like the opposite of what people suffer through, what they have pity parties for. And it's not something that's ignoring the problem. It's just like, well, I also have this. So.
Right, it's both, but gratitude is so powerful. I can't even tell you the magnitude. It's changed my life. Absolutely. I just did a 28-day course on this, an action step every single day that by the time you're done, we deal with finances, relationships, health, everything. And it's life-changing, but it's not just about saying, oh, thank you. It's so much more. There's so much more to that. So
that's amazing.
Find some joy. It's there. Find it.
Absolutely. So if you're still struggling, you can reach out to us at Ascent Health Center. We have counselors, psychiatrists. Like I mentioned, we do ketamine infusions, TMS, a lot of different interventions for treatment-resistant depression, anxiety, a lot of these issues. Or they can reach you and it's the best way through your website, or how can they best contact
website
you?
Or through the phone number, either or. Text message is fine there. It's my business text, so you can always shoot me a text. Hey, I've got something going on. Or check out the website. We can just chat and see how best I can help pry you out of wherever you're stuck.
Absolutely. Well, thanks for coming on today.
Thanks, Nick.
You are watching WCTV, Wadsworth Community Television.